I think this question has two parts. One is cocaine use and how do we manage this? Now, cocaine is a stimulant, as we might know. And by stimulant, I mean that it makes people very excitable, high, and agitated. And the high is what people try to get when they take cocaine. So cocaine causes a rapid release of a happy chemical called dopamine in your brain. That chemical can be released by doing sports, by doing jogging, by doing exercise, but they're released in smaller amounts and they make us feel good. But when you take cocaine in small amount, there's a rapid surge of this happy chemical. Consequently, you feel very high, happy, and elated. And your concentration and your focus is also temporarily enhanced and increased. Unsurprisingly, this drug is very desirable. As per the law, it's a class A drug and it's illegal even to have possession of a small amount in your pocket, unlike cannabis and so on. So if you get arrested with cocaine, then you're almost certainly going to be in significant trouble. Therefore, it's not easily available, and thankfully not easily available. But one of the problems with cocaine is that it causes rapid surge of dopamine, but it also causes rapid highs and rapid crashes. So people, when they go into very high state, the mind is hyperactive and hypervigilant, the pulse rate goes very high, they can have irregular heartbeat and rhythms, which can sometimes lead to heart attacks or heart failures. And when they go into a crash after having taken cocaine, then they tend to feel very depressed and pessimistic, which might lead them to take more to go back into high. And consequently, we see people having cocaine overdoses because you never know how much is enough and how much is too much until you suffer the significant problems. So it's a dangerous drug. It stays in the system for a short period and it can cause all kind of complications of the brain, of your heart, and so on. So it's best to be avoided. And it's a illegal drug. So even possession of a small amount in your pocket is going to get you into trouble. Now, cocaine, because of the rapid effect, it's very, very addictive. So people after one or two use can become very highly reliant and dependent on it. Unlike cannabis, unlike alcohol, where you have to use the substance or drink for a prolonged period of time before you become dependent on it. So for example, a lot of people drink alcohol, but for them to become dependent and reliant on alcohol, they have to drink regularly for a prolonged period, and in many cases on a daily or multiple times in a week before they become dependent on alcohol. With cocaine, you can become dependent very quickly because of its rapid action and rapid response to the chemical of getting highs and so on. So it's very addictive. So they require intense amount of counseling, intense amount of education, and intense amount of advice on the drug itself and the perils of using this drug. And that requires a specialist intervention, a specialist hand, and a specialist manner to sit down with the person to guide them systematically to the drug use. But it also requires other therapeutic interventions where we need to try to understand the reasons for them to reach out to the drug as compared to doing other things. So in many cases, people take drugs to manage their emotional turmoil, their relationship problems, or other life stresses. Again, going for a shortcut remedy instead of talking and sorting it out. So we need to understand the triggers and the circumstances and situation and try to help them find alternative ways of managing their turmoil or difficulties instead of reaching out for the drugs. 3, we need to look at medication because it causes an intense surge of dopamine. High levels of dopamine in the brain will not just cause highs, but it has a tendency for people to make people very psychotic. And by that I mean, psychosis means the people will start to have experiences where they lose touch with reality, they'll have delusions, fixed thoughts when there's nothing to account for, they have hallucinations where they hear voices, they can have jumbled up thought processes, they can be extremely paranoid that people are out there to get them, that the CIA or the MI5 is going to attack them, that they are at risk, their family are at risk, or that the state authorities are pursuing them. Imagine being in such a state of psychosis is going to be very disruptive, and in such a state, an individual is at high risk of ending their life or attacking another person, believing that they might be attacked if they don't retaliate preemptively. So we need to treat the psychosis with medicines. In many cases, we can treat them with medicines at home. Sometimes we need to hospitalize them if they're having intense psychosis and give them antipsychotic medication to bring down the dopamine levels. So this can be treated rapidly, provided one seeks intervention or a family who encourages the person or takes the person for treatment. So if we do medicinal intervention in psychosis, if we do education, advice and guidance, and finding alternative ways of managing their affairs and difficulties, emotional problems, and so on and so forth, then they can be got out of their difficulties, their substance abuse. One of the important things to think about is that if somebody is using cocaine, then it is very likely that they're using other drugs like cannabis, like heroin, in many cases over-the-counter drugs such as sleeping tablets, tranquilizers. Many of us would have known that you borrowed your tablet from your grandmother or grandfather and been taking it. The pharmacist, so you go there and he gives you a control drug to say, okay, I haven't got my prescription, therefore. And people start abusing those drugs. So when you can't get cocaine, you take cannabis. When you can't get cannabis, you take sleeping tablets. And when you can't get that, you look for other things. So this cross addiction is also quite prominent in people who abuse or are dependent on drugs. So you need to look out for that. The easiest thing to go for people when they can't find hard drugs or soft drugs is to drink alcohol. So alcoholic addiction is also very common. So that is something that you need to look out for when you're treating the individuals, to say that if you have this, there's likelihood that you might have something else as well. So unless we ask, you're not going to get that information. And individuals who use drugs and alcohol will have an enormous sense of inner guilt that, one, they might have brought it on upon themselves, and two, that if they reveal their problem, they will be rejected and seen in a punitive manner. So what do? They're going to minimize it. So if you take 4 drugs, then you end up saying that I only take 1. If you take a lot of cocaine, then you say I take very little. If you drink a lot of alcohol, then say, no, I'm not addicted to alcohol. I can stop when I want to. So they minimize it, both in terms of amount and the extent of problem. What, as a psychiatrist, we do is that we look at simple aspects of assessments. We think that the devil is in the detail. So when you talk and ask, politely probe in a non-confrontational manner, and people open up to say, yes, I take this as well, and I take that as well, and that's been a little bit out of control, and so on. So you need to talk, open up, allow the other person to talk, listen to him, and then keep probing to get more and more information and details about the amount of drug use, the severity, the extent, the reasons, and so on, and get the same questions for each of the drug and alcohol that is used. When we do that, the process itself is therapeutic. We don't want to know that we are doing something out of our control. But when somebody is asking us questions, then you realize that, I never realized that I drink every day. And that for the last few days, I've been waking up in the morning and drinking, just like they showed in Devdas. Devdas would drink in the mornings to wake up, or early in the morning, he'd wake up and reach out for the bottle and drink first before he's able to even utter a word. So when you get to that level of drug use, then it becomes a severe problem. And then it requires a detailed, empathetic and understanding approach to an individual. That's when you can help people come out of the substance problem